The next document is consent for oral and maxillofacial surgery. You have the right to be informed about your condition and the recommended treatment plan so that you can make an educated decision as to whether or not to undergo the procedure after knowing the risks and hazards involved. This disclosure is not meant to alarm you, but is rather an effort to provide information so that you may give or withhold your consent. Patient's name, signature and date. The procedure or procedures necessary to treat my condition or conditions have or has been explained to me, and I understand the nature of the treatment to be provided. And then in the patient's own handwriting, they need to write what they believe to be the procedure that they are going to undergo. I understand these other forms of treatment or no treatment at all are choices that I have, and the risks of those choices have been presented to me. My doctor has explained to me that there are certain inherent and potential risks and side effects associated with my proposed treatment, and this specific instance they include but are not limited to post-operative discomfort and swelling that may require several days at home recovery, prolonged or heavy bleeding that may require additional treatment, injury or damage to the adjacent teeth or fillings, post-operative infection that may require additional treatment, stretching of the corners of the mouth that may cause cracking or bruising and may heal slowly, restricted mouth opening during healing, sometimes related to swelling and muscle soreness, and sometimes related to the stress on the jaw joints, the temporomandibular joint, especially when the temporomandibular joint problems already pre-exist. A decision to leave a small piece of root in the jaw when it is removed would require extensive surgery or risk other complications. Fracture of the jaw, usually only in very complicated extractions or surgery, injury to the nerve underlying the lower teeth resulting in pain, numbness, tingling, or other sensory disturbances in the chin, lip, cheek, gums or tongue, and which may persist for several weeks, months, or in rare instances be permanent. Opening of the sinus, a normal chamber situated above the upper back teeth, requires additional surgery or treatment. Dry socket, which is loss of blood clot from an extraction site, allergic reactions previously unknown to any medications used in this treatment. It has been explained that during the course of treatment, unforeseen conditions may be revealed and may require changes in the procedure. Noted above, I authorize that my doctor and the staff to use their professional judgment to perform such additional procedures that are necessary and desirable to complete my surgery. Anesthetic risks include discomfort, swelling, bruising, infection, prolonged numbness, and allergic reactions. It has been explained to me, and I fully understand, that a perfect result is not or cannot be guaranteed. I certify that I have read and fully understand this consent for surgery, have had questions answered, and that all blanks were filled in prior to my signature. Please ask your dentist if you have questions concerning this consent form. This document then needs to be signed by the patient, witnessed. The date and time needs to be added to this document, including the date and time of the witness. And finally, the surgeon needs to sign, date it, and place this in the patient's file.